am Dr. Sanjiv Shah, Senior Diabetologist, experience in global trials, clinical pharmacology, and a key opinion leader. My today's talk at DIACONE 2022 at Ahmedabad was multifactorial approach to management of diabetes using once weekly dulaglutide. As you know that multiple types of oral agents are available, the best in class is GLP-1 receptor agonist. The reason being, compared to any other oral agents, GLP-1 RA offers up to 1.5-1.8% HbA1c reduction, far more than any other oral agents. It is by guidelines the first injectable therapy before you start glargine insulin. In comparison, it is similar or superior to glargine in efficacy, but without causing any hypoglycemia and with weight loss as a property. The current shift in approach is vasculocentric, cardiocentric rather than a glucocentric. So CV outcome trials are very important, and if you compare CV outcome studies, the population who were enrolled in Rewind study, which was a 5.5-year long CV outcome study with dulaglutide, while all the other trials were done for 3 years, enrolling patients with proven CV disease. Rewind trial enrolled 70% of the people without having CVD, so it was truly a primary prevention study. And the result showed that 3-point MACE outcome benefit was similar with dulaglutide, even if it had primary prevention population, similar to liraglutide and similar to semaglutide, other two agents in the same class. So if you look at how to use, where to use, once a week dulaglutide had really good tolerance, a good usage all over the world, well experienced by many consultants during last 5 years, and at June 22 ADA there was a paper where a comparison with oral semaglutide was done. A persistence and adherence with dulaglutide once a week was much higher than oral semaglutide tablet. When it comes to efficacy, all are same. Unique feature of this dulaglutide action is effect on gastric emptying. So slowing of gastric emptying reduces postprandial blood glucose level far more than any other agents. Effect on the brain center with reduction in appetite will result into elimination of craving and reduced quantity of food being consumed. So this kind of mechanisms, along with weight loss, improvement in dysfunctional adipose tissue, would result into all the benefits what we see with GLP-1 RA agonist, and dulaglutide had been very, very successful in the hands of multiple practitioners of diabetology all over the world. When it comes to a side effect issue, people are afraid that 10-15% of patients develop upper GI side effect. So we advise the patient to have slowly to eat their food, lower fat content, and more frequent smaller feeds. At the same time, I prescribe anti-emetic tablet when I prescribed Trulicity to all my patients. So this takes care of their nausea, vomiting, which are maximum in the first month of beginning of Trulicity, and subsequently second, third month onwards. Most people tolerate the drug, then there is no issue. The continuation rate would be much higher. The side effect profile is more or less similar. There are no other side effects, no increased incidence of hypoglycemia. It is exactly similar and free from hypoglycemia. So it's an excellent molecule. I recommend many practitioners to try. As you build up your experience, try to use more and more in more and more patients. With this, I would end. Thank you for looking at this particular video.